the majority's attempt to repeal reform and turn Medicare into, let's not use a voucher program, let's not use that word, I call it the more out of your own pocket, folks, program. I think that will hurt beneficiaries. And there's no doubt about it. This is going to mean more money out of pocket. No one has denied that. No one. So according to the CBO office, the Republican budget will dramatically cut spending in Medicare for new beneficiaries by more than $2,200 per person per year. That's what the CBO says. And we conveniently use the CBO when they support our position, and then we tell them that they don't know what they're talking about when it doesn't support our issue, our position. And starting in 2030, by $8,000 by 2050. You want to talk about the future? Let's talk about the future. We don't have to scrap the current system. In fact, as we're sitting here today talking about strengthening Medicare, the health care reform bill is already hard at work actually testing new payment and delivery systems that will lead innovation not only for Medicare but for the entire health care system. And let's talk about that health care system. You're talking about competition. Let's increase competition in terms of Medicare. We don't have competition in the health care system. Many states have only 2 or 3 companies who write health insurance. Why don't we do something about that? If we want to foster competition, let's foster competition. We don't merely mean it. This is pyrrhic. It's empty. These are words that we use back and forth. This is one-upmanship. That's all we are after. The basics of health care will be changed by the Health Care Act for the better of Americans. It will not be a socialistic system. Thank God we graduated from that, since more insurance companies will be involved in order for us to gain favor with the people that we're dealing with. This is, we're heading back to 1964. I am convinced that that's the direction we want to go in, when senior poverty was at the greatest since the Great Depression. That's where we want to go. Why don't we just say that? We're using a lot of pretty words. Yeah, you may shake your head, Mr. Idlin, but I am telling you, we are marking time in place while many seniors are being stopped at the door because they are under Medicare. That's what we should be addressing. That's what we should be saying, enough of this. The health care system is not working. The health care system has been totally taken over by the health insurance companies of this country. You know it, and I know it. We don't have competition. In New Jersey, what do we have, 3 or 4 companies that write health insurance? This is competition? What is this competition? So we'll narrow it. Maybe next year we'll have 3 companies. Maybe company C will take over company D. How many states do we have only 3 or 4 or less companies writing health insurance? And you want to put our seniors into that situation? That's not competition. That's a joke. You know it, and I know it.